Welcome back to Spotlight, and I don't have to call Dr. Uguagu name anymore. and not that I'm glad, because he's not feeling well and he couldn't be here with us tonight. But it's not quite so much of a challenge. I want to welcome Dr. Natasha Frith and Dr. Anel Sola.
Yes, good evening.
The Spotlight. Yes, good to have you. Pediatricians from the BVI Health Service Authority. And I didn't know that BVI Health Service Authority had 3 pediatricians.
Yes, we do.
Yeah, that's good. That's good news, because I know it's been a concern, a public concern, for many years that we didn't have enough pediatricians on the island. I think we had. And you're the first local pediatrician.
Yes, I'm the first local.
Yeah, I think it was a problem some years ago. So we're glad to see you.
Thank you.
Yeah, we're glad to see you, and of course we're glad to see you too, Dr. Sola. What's the role of the pediatrician? Let's start off with that.
Well, a pediatrician is supposed to be a board certified doctor because it's a specialist type of doctor. In other words, after 6 to 7 years of the primary, the initial going to the medical school after graduation, it's either you become a general doctor or you proceed to a specialty. And we decided, Dr. Frith and I probably decided long ago that we'll go to pediatrics. And it takes another 4 years to have that specialty. And after 4 to 5 years of undergoing a training, then you take your licensure or your exam on a board certified exam. And therefore we are fully trained basically for a pediatrician, a general pediatrician, fully trained to manage all cases, at least the initial management of all conditions relating to children. Now in BVI, pediatrician deals with before your 16th year birthday.
Okay, so you're considered a child up to 16 years old in the BVI.
Well, that is in regards to medical management. However, by some standards, they consider children up to 18 years. I think by the law, there are certain tenets of our law that states that the child is under the age of 18. And also in America, they consider children to be up until 21. So generally speaking, both of us are coming from 2 different medical cultures.
Correct.
Right. I'm more from the British culture.
I'm more westernized because there's more in the Asian ones.
Right. And so our age limit is up to 21, 18 and 21.
But in terms of care management, where's the medical separation? You know, when you talk about child care, child health care management and adult health care management, is there a physical aspect of that delineation where you say, okay, well, children need this special care? Because I hear your advertisements, and it says that, you know, people think that children are little adults, right? And they're not. So where's the cutoff point? I mean, not in terms of age, but when do you say it's time now for me as a person, or for this child of mine to go to other kind of adult
specialist?
Yeah.
Well, as we mentioned, it can go up to 21. So by 21 years, you as a physician, as a pediatrician, can say, all right, time to go to an adult doctor. But you would find in some cases that by the age of 16, depending on the situation, for example, if they need specialist care, we would refer on to an adult specialist, at least by 16.
Because traditionally we follow actually the age.
Right.
Okay, so if I see my patient already like turning 16 years of age, like probably next week, then it is just proper for me to refer the child now to an internist, okay, who deals more with adults in BVI. But you know, in other countries, it would be up to the 21st birthday, because that's a late adolescent. 21. Before your 21 birthday is your late adolescence.
So there is a very fine line, because there are some children or there are some young people who become so attached to their pediatrician that by 21 years they don't want to, up until 21 they don't want to leave. Right. So, but traditionally it's up until the age of 16 years.
Okay. Now, here in the Virgin Islands, we it seems to me, and I don't know if this if this is something that you've been able to discern since you started practicing here, and you as well, Dr. Sola, that we don't bring our children to the doctor, to the pediatrician, until they're sick.
Yes, yes.
And that seems to be a general concern of I guess your profession. How are we managing that challenge? Is that something that we as a people need to be educated about? Why should we bring our children to the doctor if the child is not sick?
Okay, well, firstly, children, one of the things that we have to be cognizant of is the fact that children are going through a dynamic process, and that is growth and development. And because of that, a number of things can go wrong, a number of things can be missed. And so this is why it is important to bring your child to the physician on a regular and a periodic basis, because you want to ensure that they can optimize their growth, optimize their ability to achieve their milestones. And so there are scheduled visits that are recommended by a number of different bodies. At the BVI HSA, as a pediatric unit, we utilize the American Academy of Pediatric Bright Future schedule. And with this schedule, what happens is that the child comes to the pediatrician and we do screenings of different developmental disorders, different physical conditions, and so forth. So they would come to the pediatrician at particular points where we know that these particular conditions might begin to manifest themselves. And so when they come, we ask a number of questions. We do, of course, a physical examination, and we get an idea as to how the child is transitioning through the different milestones and whether or not they're achieving them on time. And what that does for us is it helps us to anticipate. It also helps us to prepare the parents for what is to come, and also anticipate that if this child has a problem, where do we start getting other persons involved? For example, if the child is not walking on time, when do we get the physiotherapist involved? If the child is not speaking on time or not speaking clearly, I mean, I've heard many times some people would say, oh, but my grandfather talk late. And it's really a problem in this particular scenario. So in their minds, it's normal, and they're expecting it because they have a family relative that spoke late. But to us, it's abnormal and needs investigation. So when we're able to pick that up through the scheduled visits, then we can say, okay, all right, so this child needs some medical management. Okay, this child needs some assistance from our colleagues in speech therapy. They need hearing evaluation. So that's one of the reasons why the scheduled visits is very important for the pediatric.
Yeah, and to add to that, you know, the leadership of the BVI Health Services Authority, together with the Chief Medical Staff and also with the Ministry of Health, basically we are trying to change. We are very aggressive, you know, changing that mindset that bringing children only when they're sick. We are providing really aggressive well-child health visits, particularly this year, starting this year, because we want to at least intervene with the problems that, you know, because you can manage them early and the outcome would be better.
Right.
Now, you talk a lot about the stages of development. Can you tell us as quickly as possible what those stages are, so as parents we could be alerted to what our child should be doing when?
Oh, wow, that's a mouthful. Okay, so of course you have your newborns,
Right.
the newborns up until 28 days of age. And then you have infancy from 1 month up until 3 months.
Okay.
And then you have
But
late-
as you go from the first month, a child should be doing what? Just sleeping, right?
well, okay.
if we are
so when we look at stages of
Stages.
development,
Yes.
right? There are about 3 to 4 spheres that we observe. For example, the utilization of large muscles, what we call gross motor. So, for example, some of those parents who have come to our clinics would hear us say, so, is the child walking? Is the child sitting up? And it's one of those things that would assess if the child is ready, because it's progressive. First, the child would lift their head, and then they realize that they begin to lift their torso, then they sit up, then they're creeping, then they're holding on to the table edge and walking, and then they're walking on their own. So those are the different milestones, and you anticipate that at particular ages that they would accomplish those. So that's the gross motor. Then another sphere we look at is the fine motor. That's their ability to manipulate things with their hands. So we would ask them things like, well, are they bringing their hands together? Are they reaching out for things? You know, can they draw circles and so forth? Another sphere would be that of language. So whether or not they're starting to say any words, are they appearing as if they're talking to you? You know, even if it's in their baby language. So are they speaking to you? Are they expressing themselves appropriate? And in addition to that, are they receiving? Are they being able to hear what you're saying and interpret it appropriately? So that would be the receptive part of the language. And then of course there's the social and adaptive skills. So one of the famous things is potty training. Are they potty training, or are they feeding themselves? Are they helping to dress themselves? So within each age group, you find that we would have these different spheres that we address. Now, to go through,
Well, yeah,
very-
what I'm hoping for is that, and of course in the interest of time, but what I'm hoping for is that parents watching would be able to say that, well, from birth to a month, during that period of time, I'm looking for my child to hold their head up.
Yeah.
And then if I don't see that, I could come to the doctor and I could say, you know, it's been 2 or 3 months now and the baby hasn't held his head up as yet. Is that something I should be concerned about? I want our parents to be able to do that.
Yeah, those are like milestones, and they should be appropriate for age. And therefore, what you're saying is, you know, that's the reason why it is very important that parents, you know, they need to bring their children to a board-certified pediatrician, because there are certain red flags that you have to watch out.
Right.
For example, if you don't have social smile at the age of 3 months, then most likely there's something
Something's
wrong with
wrong.
your
If you
child.
don't have
a social,
a social smile.
Oh, the
Like,
baby
you know,
is not smiling.
Correct.
Right.
Yeah.
In other words, there's no reciprocal smiling, or the child doesn't start babbling at around 6 months to 9 months. He's still not babbling. Then most likely, probably, you know, the child could not hear, or there are times that the child could not sit up. You know, at around 6 months, then you should be. That's already
Concern.
a red flag, concern.
Right.
And like standing up at around 1 year, 10 to 12 months,
Right.
then most likely that's already a concern. So those are red flags, and that is the reason why well child health visit is very important. And that service is really, it has been there, you know, but it's just that most likely we are more aggressive in going to radio stations now. Like 3 weeks ago, I was in a radio station talking about these things also.
So you want, and yes, and I think it's important for us to educate our parents, because of course the reason being that you would be able to intervene at the
Right.
earliest stage and perhaps address and arrest whatever the challenge may be.
Right, correct.
Yes.
Okay. Now there's a difference between development and growth. Is there in children?
Yeah,
When we talk about development, we usually think of growth, but is growth one thing and development something else?
It's a fine line. Usually when we think of growth, we are thinking about height and
Physical
weight,
growth.
The parameters.
head circumference, those parameters, because of course they can be impacted by a number of things, including nutrition, genetics, certain disease conditions. When we think about development, we usually think about the milestones, you know, walking and talking and expressive language, receptive language, cognition.
It's more psychological. Yes.
Not quite psychological, because the milestones of walking and so forth not really lend to that area, but it's more so of functioning. Of functioning, yeah.
Okay. Now, so at the growth after, I guess the growth would be, they have to do a lot with genetics as well, right?
Well,
how tall I'm going to be at a certain age.
Yes, there's what you call a mid-parental height.
Mid-parental,
you know, there's a computation between the father and the mother. You take those.
There's a formula.
There is a formula for there, and actually there's an app. Just to find out whether your child will reach a certain height. You know, but usually it's more on maternal. You know, meaning if the mother is tall, then most likely your child will be taller than, you know. So basically, those are the things that we monitor also in a Well Child Health Clinic, because we need to find whether, to look for any abnormality in the growth. Basically, it's more of the growth parameters.
Right. So that's one of the things that pediatricians really spend a lot of time looking at in terms of their growth, their height, weight, head circumference, and also the rate at which they're going. Is it that they're growing too small? I mean,
too
slowly,
too fast.
Too fast. And that is where, as Dr. Soler was pointing out, the genetic factors and the mid-parental height comes into play, because then we start to do a projection, and we start to project where this child should be at age 18. And then from there, we try to extrapolate and see whether or not they're on the right course, or whether or not they're really stunted.
And the other thing that you will realize, especially the parents when they bring their children, a pediatrician, you know, will be using a lot of charts.
Yes.
Okay, he or she will show you the charts. Now, those who are not trained are not familiar with those charts, because those have been, this is a collection of studies. And therefore, those are evidence-based charts. And you'll be able to catch as soon as possible, as early as possible, those abnormalities.
Right, because with those charts, what we really look at is trends. So it's just not bringing it to the pediatrician one time. You need several points to plot. And then with that, you're able to see how the child is tracking. And most of these charts, they have like curves, different kind of curves, and then you would see whether or not the child is going along the particular curve. And if they start dropping off the curve or moving too fast on the curve, then you start to think, you know, what is happening with this child.
So you start to investigate.
You start
and
to
therefore,
investigate.
that's why you don't shop. Going to different doctors, because basically your pediatrician is also your primary physician, meaning for your children. And if you go to a particular pediatrician, he or she is supposed to have all those charts. And that's why Dr. Fred is saying the trends. Because if you go to different doctors, you won't find the trends. You will not see the trend.
Okay. Now, how important, or what role does nutrition play in growth and development of the child?
Oh, wow. That's another huge topic.
Make it short.
Yeah, it's very important, really, because of the obesity problems right now, and the Ministry of Health is really into that, okay? Because like this year they had like a workshop,
Several workshops.
Yeah, a workshop, and I think Dr. Fred or Dr. Christian attended it, you know. So because it has been a long thought that if you have a big child, it's a healthy child. Correct. But obesity is a malnutrition, okay?
Yes.
It's not only because you have a low weight and then you're malnourished, but it's actually obesity is a malnutrition, and it is connected to other diseases.
Right.
You have an increased risk of having heart attack when you become an adult. There's dyslipidemia, meaning high cholesterol levels, stroke, okay, depression, bullying, So it is connected with other
Right, a lot
issues,
of
and
different
therefore
issues.
it is very important, really, that obesity should be tackled.
Yeah.
Right.
But also for the development of the child, the development of the functions,
Right.
the physical, the parameters, the physical growth,
Right.
and so on. That before you become obese, we need to look at what the children are eating, so that they develop proper brain function,
Right. Well,
proper motor skills, physical growth, and so on. So, what do we tell our parents about that nutrition from that perspective?
okay, well, when children come to us, for example, in a newborn period, one of the things we always want to emphasize is breastfeeding, right? Because within breastfeeding, it has all the nutrients that the child would need, in addition to the ability to fight off infections. So breastfeeding is one of the...
Is the best thing.
Right, is the best thing, and it's the one of the earliest nutritional advice that we would give to our parents. We do understand the whole concept of formulas and so forth, and there have been a number of studies, primarily by the drug companies who promote formulas, on what substances are best in terms of to be in the formulas. And what we do find is that a lot of them are vitamins that you get from your natural fruits and vegetables and so forth. And so once the child is eating a well-balanced diet and is receiving breastfeeding accordingly, the child should be okay.
How long should we breastfeed?
It's recommended a minimum of 6 months.
Minimum of 6 months.
Right.
Okay. Biblically, I've heard 2 years.
Yes.
Yeah.
Yes.
But that's scientifically as well.
Correct.
Yes,
correct.
that is scientific.
Because
There's a minimum.
A minimum of 6 months, but
6
up
months.
to 2 years and beyond.
there's also misconception in our area now that milk formula, you know, the one we buy in the grocery for children, is like at par with breast milk.
Right.
That
And
is
it's
not
not.
so true.
It's not.
Because
They
you see-
cannot duplicate breast milk.
Correct.
No, no.
They try to.
They're
duplicate.
trying, they're
the
trying,
milk
they're
formula is actually, the infant formula is actually a processed cow milk.
Right.
And it's just much expensive than a cow milk, but because they're trying to remove those things, those particles that are not supposed to be there, because they are really for cows, you know.
Right.
But still, if you have a child who's very allergic, you know, even at infancy, like even at 1-2 months, the body is able to detect that small particle that's
Right.
not supposed to be there.
And,
You
and
see?
it might have an adverse effect on the child.
Correct.
Right.
So, because any allergy will try to pull down the development of the child, meaning caloric use, the proper use of the calories, instead of using that for body growth, it is being used to fight off the allergies. So now you might end up with a malnourished child. So that's why Dr. Fett, I think, also at and we're trying now in the process, still we're undergoing the process of having a baby-friendly hospital.
Right.
Yes.
Basically, we're practicing that, but we're still getting at least,
We
you
still
know,
get
the,
some
the
resistance.
WHO, correct?
Right.
So
And
we
we're still
try
in
to
the,
encourage more breastfeeding. And I
Right.
know the
Yeah.
hospital is equipped with rooms and facilities
Yes.
to encourage breastfeeding.
they already,
Yes.
they came here like a year ago or.
Right.
Yeah.
Last year, the PAO was here in terms of training persons, not only within BVI HSA, but also within the community to be breastfeeding specialists, lactation specialists. So we do have trained persons and who are advocating for breastfeeding out there. But also in regards to nutrition, the other important reason why it's important to bring your child to the scheduled visits is because at those particular times where we're expecting growth spurts in some of them and so forth, and probably, you know, refusal of food, you know, the terrible twos when they don't want to, they're very picky, the picky
You'll be able to
eaters.
tell what's going on nutritionally.
Right, you'll be able to examine and look for red flags in your examination in regards to nutrition, and also be able to look at the different growth charts and tell whether or not the child is projecting well. So we always encourage a well-balanced diet, because I know a lot of people like to advocate for the over-the-counter multivitamins and so forth, which are fine. But the body tends
And don't say
to...
they're fine if they're not. You know, we don't be politically correct.
the body does better when it extracts them from food.
And let me ask you, at what age should we give our children food? You know, you're breastfeeding all along. So at least for 6 months you should be breastfeeding. Sometimes up to 2 years is better. But at what point? I see a lot of parents giving children chicken bone, and
Well,
I mean, you know, the babies that can't walk yet, don't maybe have 1 or 2 teeth. Sometimes don't have any teeth at all. They're giving them, you know, chicken bones to suck on them with little pieces of meat and so on. When should we be giving children that type of food?
Well, it varies between children, because ideally what you want to happen is that the child is sitting up.
Okay.
That's what you want, which is at 6 months.
And you give them soft foods.
Right, you
Like-
give them
like
mashed food.
Mashed
right.
food like carrots and vegetables and so on.
So that is the time where you actually should be, you know, increasing the thickness and so forth of their food when they're able to sit up.
along with the breast, along with the breast milk.
Yeah, there's also one principle, like there's a concept of, you know, sucking and swallowing is different from swallowing a solid food.
Right.
Okay. So usually, Dr. Fett said that it's around 6 months. But sometimes, you know, if you have no family history of allergies, you can do it early, like 4 or 5 months of, you know,
you can start,
because then you can try to override that sucking and swallowing reflex. And then by that time of 6 months, and that's the time you now give pureed food like pumpkins with potato, you know.
Those
So
fruits
those
and
are the
vegetables.
things.
Right.
Yeah.
We are
And
under the
then,
tyranny of the clock.
Pardon?
We are under the tyranny of the clock. We run out of time.
oh,
Yeah. they
That's right.
they keep flashing the sign on the screen. I keep ignoring it.
okay.
But and there's so you see the time gone.
Yes.
We didn't get to have the stuff. But I'm encouraging you to really stay in touch with me, and let's have regular programs.
40 minutes gone for you?
Yeah.
Oh, really?
Yeah.
We haven't said the services of the People's
Yeah. So
Hospital.
tell us the services, the pediatric services. Give us a list of the pediatric services, quickly.
Okay.
Oh, so start from newborn.
Correct.
We could start from newborn. At the newborn time, we have a screening process where we do a metabolic screen for the children, in addition to a hearing screen. And we do that in association with the audiology department. Then we have our well child schedule visits, which is a schedule, and you know,
You need to stick with the schedule.
yeah, just stick with the schedule.
Yeah.
And of course, during that time as well, there are times when we would start referring to other specialties. So, for example, we may refer to the dentist at particular times.
Now, to add to that, we don't only work in the hospital.
Correct.
We also provide community pediatric services
Right.
in the community, like in
You
Long
come to the clinic.
Correct.
Right.
In
We
Long
do.
Look Clinic every Thursdays from 8:30 to 2 o'clock in the afternoon. In Virgin Gorda, Iris O'Neill, we're there, and actually every Mondays. But now we have a dermatologist, so we do go there only on second and fourth
Fourth
Mondays of
Mondays.
the month.
And we
So
started
that's
at-
also from 8:30 to 2 o'clock in the afternoon, and you see pediatrician there, they're board certified. So and then for Mondays, Tuesdays, and Fridays, we have clinics from 8 to 2 or 3 o'clock in the afternoon in Peebles Hospital.
Yeah.
So we encourage all people, children, you know, to go and attend the well child health visit.
visits, yeah. Come and see us.
Okay, great. Dr. Natasha Fred, Dr. Anna Soul, thank you very much for being my guest on
Thank you for
Spotlight.
having
Thank
us.
you.
And I look forward to talking to you again to continue the discussion, to continue to inform and educate our parents about the growth and development of our children and what we need to do to raise healthy, well-adjusted children in our community.
Okay.
Thanks.
Thank you.
Thank you.
Yes,
you.
we're going to take a quick break and we're going to come back with science teacher Ms. Bianca Dugan, and we're going to be talking about the upcoming fundraising talent showcase at Elmore South High School. Keep it locked. We'll be right back.
Spotlight is brought to you by the National Bank of the Virgin Islands, and CCT Global Communications.